Hello, my name is Jada Hines, and I'm a junior psychology pre-med major from Denver, Colorado. Today I'm going to be talking to you a little bit about my research project. The topic that I chose to study was schizophrenia and how it is affected by the child's mother having a virus while the child is in the womb.
The brain is such a complex system, which makes it very hard to treat mental disorders. Researchers must fully understand the cause of the behavior down to the smallest neurological details in order to begin to try to find a drug that would completely treat the patient. Schizophrenia is a mental disorder that translates from the Greek as split minds. While researchers vary in their beliefs of the origin of this disorder, accounts of people who are affected by schizophrenia date back thousands of years ago and were recorded by ancient writings. In a previous study, researchers Femi Early and Candia stated that exposure to influenza virus puts babies at a significantly higher risk for developing schizophrenia. Viruses are parasites. They are smaller than bacteria. They attack the host cells in the body and replicate their own DNA in order to carry out their specific function. Researchers Whibble, Anderson, and Sinton found that the prefrontal cortex specifically has been a place in the brain where deformity might result in schizophrenia. They concluded this because they found that patients who presented with schizophrenia also presented with reduced levels in white matter. My research project seeks to merge the two theories of both of these research groups in order to see if there is in fact a virus that is affecting the prefrontal cortex specifically. The purpose of this research is to see whether there is a correlation between mothers who had viruses during their pregnancies and mothers who gave birth to children who developed schizophrenia due to the residual underdevelopment of their prefrontal cortex.
To recruit participants for this study, we will ask for volunteers. We hope to have 50% participants who have schizophrenia and 50% participants who do not have schizophrenia, and volunteers will be compensated for their time.
All participants must be able to provide statements from their doctors saying whether or not they have been diagnosed with schizophrenia. Participants must be able to also provide their mother's medical history from the time that they were pregnant so that researchers will be able to see whether or not the mother had a virus during her pregnancy. Each participant will be briefed on what they will experience while getting the fMRI. They will also be briefed in the potential risks in participating in the study. All patients will be given a loose-fitted gown to wear into the fMRI machine. Jewelry or metal of any sorts must be removed. For this test, there is no prior fasting required. fMRI stands for Functional Magnetic Reasoning Imaging. An fMRI uses its ability to detect changes in blood flow to examine the anatomy of the brain. This study will use the methods used in the dorsolateral prefrontal cortex MRI measurement in cognitive performance in autism. This is a study done by Gramling and his associates. This research was done to look at the volume of the frontal lobe as it correlates to the performance in a task. We will use this method in order to narrow down the units of measurement and to look only at the prefrontal cortex. We plan to use a General Electric 1.5 Tesla Sigma scanner. The scanner will be used to generate 3 different types of images. The 3 different types of images will then be used to examine the volume of the prefrontal cortex. We will use sagittal images that are parietal to the midline, axial images, and coronal images. In accordance with Grabling's method, we will use a two-tailed significance level test to measure the volume of the prefrontal cortex, where p is greater to 0.15.
We will also be using a t-test and a covariance analysis to compare the two groups. A large implication of my study would be that it would bring more awareness to the main factors in a child developing schizophrenia. When researchers know exactly where this disease stems from, they are able to better create drugs and treatments to help patients and their families who deal with this mental illness. If this research is done successfully and my hypothesis is proven true, a really cool follow-up future experiment would be to look at the blood of schizophrenic patients and test it to see if there is a common strain of virus that is creating schizophrenia, or if schizophrenia is generated simply by the patient being exposed to any virus whatsoever.